Hello, today you will be learning about hip range of motion. We will cover flexion, extension, abduction, adduction, internal rotation, and external rotation. So watch and learn. Normal hip range of motion for flexion is 120 degrees. The patient will be lying in supine for hip flexion range of motion. The unaffected side furthest away will be bent at the knee and hip to support the back in neutral. The affected leg will be closest to you and is straight. Placement of the goniometer for hip flexion range of motion measurement. You will use the axis of the goniometer and line it up with the greater trochanter. Palpate the patient for the greater trochanter. Once you find it, align the axis with the greater trochanter. The stationary arm will be aligned parallel to the long axis of the trunk. The moving arm will be in line with the lateral midline of the femur. Sir, if you will please bend your knee towards your chest and I will follow along. Is that as far as you can go? Okay. I make sure that my moving arm and stationary arm are aligned with my landmarks, and I will read that he has 104 degrees. As you can see, your goniometer reads 104 degrees. Now that you are done measuring, document the degrees on your chart. 104 degrees, hip flexion, left hip, and we have measured active range of motion. Normal range of motion for hip extension is 15 degrees. The patient will be positioned in prone. A pillow may be used under the abdomen, but is not required. The legs are supported in a 0-degree position by the mat. The hip will be measured in its anatomical neutral position. Goniometer placement. The axis of the goniometer will be in line with the greater trochanter. Palpate, find your landmark, align your axis. The stationary arm will be in line parallel to the long axis of the trunk. The moving arm will be in line with the lateral midline of the femur. Instruct your patient to extend their leg away and upward from the mat. Sir, can you please raise your leg? Is that as far as you can go? The range of motion measurement for his extension is 10 degrees. The hip extension was on the right hip and it was 10 degrees. Active range of motion, extension. Normal hip abduction is 45 degrees. Positioning of the patient. The patient will be lying in supine. Lower extremities will be straight and supported on the table. The hip will be neutral and measured in its anatomical position. Placement of the goniometer. The axis of the goniometer will be in line with the joint center of the hip. Take a moment to locate your anterior superior iliac spines. Align your axis with the joint center. The stationary arm will be transverse in line with your ASIS on bilateral sides. Your moving arm will be in line with the anterior surface midline of the femur. Measuring hip abduction. Sir, with keeping your foot straight and your toes towards the ceiling, let me have you slide your leg towards me. Begin. Keeping the goniometer aligned. Okay, sir, return and relax. For hip abduction, the goniometer started in a 90-degree angle. Ensure that you look at the 0, move down to 28 degrees. Document the left hip abduction at 28 degrees. Normal hip range of motion for adduction is 25 degrees. The leg being measured will remain neutral and straight. The unaffected leg will be placed in abduction, keeping the midline open and free for the movement. Measuring hip adduction. The axis of your goniometer will be in the center joint of the hip being measured. The stationary arm will be transversely aligned between the ASISs. The moving arm will be aligned with the anterior midline of the femur. You may also use the knee as a reference point. Measuring hip adduction. Instruct the patient to keep their foot straight and toes towards the ceiling. Sir, can you keep your foot straight and move your leg towards the other leg away from me? Begin. Note the 0 degrees and move across, and he was 15 degrees of hip adduction. Document left hip active range of motion adduction at 15 degrees. Hip internal rotation active range of motion is 45 degrees. Positioning of the patient. The patient will be seated with hips and knees at 90 degrees. A special neutral position for the hip will be 90 degrees in this position. Goniometer placement. The axis of the goniometer will be in line with the long axis of the femur between the patella and the tibial tuberosity. The stationary arm will be parallel to the transverse alignment of your anterior superior iliac spines, or aligned parallel to the tabletop. Your moving arm will be in line with the crest of the tibia in midline. Measuring hip internal rotation. Instruct the patient to move their lower leg away from the midline. Sir, can you please move your foot upwards and away from the middle? You just completed hip internal rotation measurement. Note you started at 0 degrees and he had 38 degrees on your goniometer. Hip active range of motion on his left side for internal rotation, which was 38 degrees. Hip external rotation, active range of motion, 45 degrees. Measuring hip external rotation. Instruct the patient to clear the unmeasured foot behind him. The side being measured, instruct the patient to move their foot inward with the lower leg. Sir, can you go ahead and turn that leg inward for me? You just completed hip external rotation. Remember that you started at 0 and he moved to 25 degrees. You just completed hip active range of motion on his left side for external rotation of 25 degrees.